In this video, we're going to talk about how to choose your medical school. Hi and welcome back to the channel. My name is Dr. Ashley Hilton, and in this video, we're going to talk about making that tricky decision as to which medical schools you should apply to. Choosing where you apply to medical school is going to be a very important decision because it's going to affect not only how likely you are to succeed with the application process in the first place and kind of influence whether you'll actually go on to become a doctor, but when you actually get there and which one you eventually go to is going to shape how you are as a doctor. It's going to shape where you end up geographically, probably for a large part of your career. It's going to shape the kind of doctor you become, the contacts that you make, and the opportunities that you get. So in this video, I'm going to talk about the two approaches that you can have when it comes to choosing your medical school, and then I'm going to talk about the 7 steps to actually choosing one that's right for you. So with the students on my program, I find that we generally have 2 types of students. We either have one that will come and know what medical school they want to go to, and then they're just doing everything that they can to tailor their application towards that. If you want to go for that approach, that's absolutely fine, but what we need to do in that case is to make sure that we know absolutely everything about that particular university and make sure that we're firing on all cylinders to tick every single box that that university wants or the requirements that they have to get in. So that will mean knowing what their criteria are, knowing what kind of grades they want, what kind of level that you need to be achieving in your aptitude tests, knowing what kind of experience and skills that you need to be demonstrating to make sure that you have a good chance of getting into that particular university. However, the second and more common approach is that I use with most of my students, which is applying tactically. You'll be amazed how crucial this tactic is and how much it's overlooked by students. And then when I have students who come to me who failed previously and then we get them in at the second time, it's because they don't realize just how tactical you have to be and how well thought out you have to be with how you choose your medical schools. So when you're applying tactically, really the first big question you need to ask yourself is, where can I apply? It's all very good saying that I want to apply to Oxford or whatever the best medical school in the world is at that time. But realistically, if you haven't got the grades, if you haven't got certain elements of your application, then it's very noble and nice thing to think, but realistically, it's going to be a waste of a very precious application spot. So when you're asking yourself the question of where can I apply, you need to base it on 3 things: your grades, your aptitude tests, and your achievement/experience. Some universities are known for requiring high grades. Some are known for being a bit more lenient with the UCAT score. Some, like King's College London, for example, will favour a really strong UCAT score and a really strong personal statement. Whereas places like Kent and Medway, and for example Warwick, if you're a graduate applicant, they want to see more experience and better kind of exposure to medicine with work experience, shadowing, volunteering, etc. And then if you're applying to an Oxford or a Cambridge, they basically want to see you firing on all cylinders in all of those areas. So high grades, high performance in the BMAT for those particular 2 examples, and then they want to see good academic achievements in your personal statement. So when I'm sitting down and working out with my students where we should apply tactically, that is the first thing that we look at. So it's important to know all the information first. So when you've got your UCAT score, once you've got your predicted grades, you need to sit down and dissect each university and look at where you have the highest chance of getting in. So that is the first step of my 7-step process for choosing the medical school. Basically, where can you go? Can you get in? Do you have the grades? The second question you need to ask is about location and interests. I think people underestimate just how important it is to actually enjoy the place that you're living when you study. A degree in medicine is said to be Monday to Friday, 9 to 5, but in reality, it's very rarely that much. But even if you did do that amount of hours, it still makes up less than a quarter of your entire week. So that's just to illustrate that even in a full-time medical degree, you still spend 3/4 of your time not in medical school doing other things. And of course, a lot of that will be sleeping, but even still, the point I'm trying to make is that it's important that you enjoy where you live because you're going to be spending a lot of time there not in medical school, and therefore being comfortable with your surroundings and enjoying where you are will make a big contribution to your mental wellness, and that will ultimately impact how you perform at medical school. So make sure that you pick somewhere that you like. Do you have an interest that a particular city is really good for that? Maybe you're really into art and Bristol has a really vibrant art scene, or you love playing ice hockey and there are only very few cities that actually have an ice hockey rink. Or maybe you're just someone who likes a big city or is more of a fan of a small town university. So the main point is don't underestimate the importance of location when choosing your medical school. The third thing is to look at the course structure and the learning style. You essentially have 2 types, which is, the first is problem-based learning, where you're given a task or a scenario and then you're expected off your own back to go away and teach yourself all the relevant material that you need to know to answer that problem. This way it's much more self-directed, You do have a tutor that you check in with and they make sure that you're along the right lines, but it's up to you, and the onus is on you to make sure that you're gaining the right information and the knowledge that you need to answer the question, but ultimately give you the knowledge that you need to become a doctor. Now, at first that might be a bit scary because at school we're used to being given a syllabus and going away and being told exactly what to learn and then just coming back and learning that so that we can pass our exams. And people might not like this style at first, but actually it's a really nice stepping stone to the independence that you need to develop to learn off your own back when you graduate and become a doctor. At the other end of the scale, we've got system-based or lecture-based learning, and that is where you essentially just attend and they tell you exactly everything that you need to know, and then it's up to you to kind of maybe do a little bit of reading around it, but essentially they provide you the information that you should know. Now this is nice if you like the reassurance of knowing that you know everything that you should, and you maybe like being spoon-fed a little bit, but you have to consider how much you like just sitting in lectures, taking back and being spoken at. And now lots of universities are doing an integrated course, which is basically taking each side of those and marrying them together in a bit of a mix of both types. So really it's up to you to kind of know yourself a bit and know whether you like at one extreme or you like kind of a bit of a mix of the two to kind of blend them together. The fourth consideration I would recommend is whether you want to do a BSc or an MSc. Now for those of you who don't know what that is an intercalated degree where usually after the third year of study you go and do an extra science-based degree. So you take a break from medicine for a year and go and do something else. So it's a science-based subject. You'll usually do a dissertation on that and gain an extra degree. Now some medical schools make that compulsory, but what you need to consider is whether it's something you'd be interested in, and then if you have a strong interest in a particular subject, maybe pick a university that is known to have good research facilities in that particular area. Number 5 is cost. Now domestic and EU students don't need to consider this as much, but if you're applying internationally, there is a wide variety of costs per year, ranging from anything from about £14,500 to about £37,000 per year. Sometimes prices vary depending on what year of study you're in, so your first and second non-clinical years are usually a bit cheaper than the third, fourth and fifth clinical years, and also your intercalated degree is usually a cheaper sum for that year. Number 6, I would say, is go and visit the uni and get a vibe for whether you like it or not. That's going to probably be the biggest indicator whether that is the university for you. And the 7th and final question that you need to ask is, when you're kind of choosing between your third and fourth choices of medical school, you need to consider whether you want to do an additional aptitude test for it. So let's say if you've got 3 UCAT unis and then you're thinking maybe you want to go to Brighton or Leeds, do you really want to do the BMAT just to do that additional 4th place that you weren't particularly bothered about in the first place? This is where, when I do my strategy meetings with my students, we get into the nitty-gritty of, well, do you want to give yourself the extra choice in case the UCAT doesn't go to plan, and then if you do the BMAT and don't get such a good UCAT score, you can then actually expand into more BMAT universities. This is where it gets a little bit personal and kind of based on how you are as an individual and your situation as to how we decide where we're going to apply and what exams we're going to sit. But really, when you're starting off, you just want to ask yourself 3 questions, which is, where can I apply? Where do I want to live? And which aptitude tests do I want to do? Then the rest of the questions will really come once you've got your offers and you really have to make a decision about where you're going to study. Because there are over 40 medical schools in the UK to apply to now, and you can't realistically go and visit every single one. You can't ask yourself all those questions about all those things. So it starts with, where can I apply? Then you narrow that down, and then once you've got a bit more of an idea from then when you get your interviews, that's really when you need to have an in-depth check of what the university is like, get a vibe for it by visiting it, so then when they ask you interview why this medical school, you can actually come up with good, realistic, honest answers. So my 2 biggest take-home messages from this are, be very aware of where you are. So make sure that you know your aptitude test scores, as in where you lie roughly within the rest of the population. You want to know how competitive your grades are, and that's going to help determine where you apply. And the second crucial bit is just know as much as you can about the application process. You'll be amazed at how many people just kind of blindly apply to universities. They just have a punt, and then when they come to me having failed with one attempt to apply to medical school, we realize that how silly some of the applications were when I actually give them the information and show them that what that particular university values and what they rank highly, that they were just not competitive in that way. And people who are good students, have a good application, but maybe are stronger in some areas than others, that actually if they would have just applied to a different university that's more suited to kind of their strengths, then they would have done really well. So if you want more information about how you can apply tactically, you can check out my website, which is future-doc.com. And then if you want some more information about applying tactically, you can check out this video here where we've got loads of useful tips as well. And if you want to check out the website, we've got loads of free videos on there as well that are going to help you apply more tactically. But probably the most useful thing that you'll find is a brand new webinar that I've just made, which is on the 4 key steps to a successful med school application. So hopefully I'll see you in one of those videos, either on the webinar, the website, or some more YouTube videos, which I'll link to here. But thanks for watching, and I will see you in the next video.